I'm Tina Adams, and I grew up in Alabama, went to college at Auburn University, and then went to medical school at the University of Miami, and residency here in Jacksonville at Shands, and worked for about 5 years with a practice that was owned by the University of Florida. And then after that, joined this practice in 2011 and have been here since. Pain in their lower abdomen is very common. Pregnant patients frequently experience this, and they're concerned that it might be labor or something wrong with the baby. And usually it's just from growth of the uterus as the ligaments stretch as the uterus gets bigger with the baby growing. Another thing that patients frequently ask about is leakage of urine after they deliver. Patients quite frequently complain of some leakage of urine after they have a baby. It's a very common concern. Usually it happens just in the first few weeks after delivery and improves as time goes on and the pelvic muscles regain their tone. Sometimes it doesn't, and if it doesn't, there are some things that we can do about that. We can help teach people how to properly do Kegel exercises. Everybody hears about Kegel exercises. You squeeze the muscles like you're trying to stop the flow of urine, but those are sometimes very difficult to grasp how to do them correctly. One of the other things that we get asked about all the time from pregnant patients is heartburn in pregnancy. This is also something that's very common. There's good reason for it. Pregnant women have a whole lot of a hormone that makes your intestinal transit time slow down. So your stomach doesn't empty as quickly as it normally does. So acid just sits there. And that coupled with the fact that as the uterus gets bigger, it pushes all of your intestinal contents and all of your stomach up underneath your rib cage. And so that leads to reflux as well. So it's very, very common for patients to complain about this, and we usually recommend that they just try over-the-counter antacids like Tums, Maalox, Mylanta. And then if that doesn't work, there are also some over-the-counter medications like Zantac or Prevacid that help to reduce the acid in the stomach that will help sometimes. If that doesn't work, there are other things we can do, so just talk to us about it. When people decide that they want to try to have a baby, we want to make sure that you're in the healthiest shape you can be before you start trying. So we want you to make sure that you're taking a multivitamin every day, that if you have any medical problems or take any medications, that those are maximized, basically, that those are the best they can possibly be before you try to get pregnant. And we also want you to make sure that you're eating a healthy diet, getting plenty of sleep, getting exercise, just basically taking care of yourself. We want you to, once you actually start trying to conceive, to not drink alcohol while you're trying to conceive, and to just basically take good care of yourself while you're trying.